The COVID-19 virus is not going to just disappear according to experts. More likely, it will become endemic. But what does that mean?
So in an endemic, this is when your epidemic level of cases has gone down, but has not completely disappeared.
It is different from an epidemic where there is an unusual and sudden increase in cases in that area. A pandemic, on the other hand, is an epidemic that crosses international borders, affecting a large number of people. There is no fixed number before a disease is declared endemic, according to Wong. It varies by disease. An example of a pandemic that eventually became an endemic disease is the 1918 flu. How did this happen? First, Wong says the flu virus mutated to become less deadly. Today, people experience the seasonal flu.
So eventually, the cases became less severe. There were fewer people dying. People came to accept a certain level of death due to the flu was acceptable for life to go back to normal.
Second, countries developed herd immunity. This is when a population is protected from an infectious disease after a certain proportion has been immunized through vaccination or natural infection. Third, since there were no flu vaccines yet at the time, the pandemic was controlled mostly through non-pharmaceutical interventions such as masking and closure of schools, businesses, and entire cities.
Once in a while, it comes back as a pandemic.
For the COVID-19 pandemic to become endemic, experts say there are several conditions to be considered.
It's a mix of epidemiology, social, and politics.
An epidemiologist from Boston University said a disease is endemic when its reproduction rate is stable at 1. This means that one person infects one other person, so the cases will remain roughly the same every year.
Yung reproduction number, or the represented with R, is a measure of how fast or slow a disease is spreading. The greater the R, the more people a single case can infect, the less likely that you'll be able to control the spread. So for example, the original Wuhan strain had a R of 3. So at that time, one person was infecting an average of 3 others.
According to studies, one case of the Delta variant can infect at least 5 other people. With Omicron, preliminary research suggests it is 4 times more transmissible than Delta. There are also social factors at play to declare the pandemic over.
People weigh also yung cost-benefit. The benefit that they're protected from the virus by living this way, being in lockdown, sheltering in place. With the cost also of putting their lives on hold. Eventually, they'll say na we're done with it. We'll tolerate this risk na lang.
Hence, Wong says the end of the pandemic is a political decision.
It will take government to say that, okay, this is an acceptable level of deaths. Hospitals are no longer being overwhelmed. They can treat other diseases.
By the end of 2021, the Duterte administration hinted at the government's shift to an endemic model.
When we started off our shift in policy, the main goal of this would be for us to be able to really live with the virus eventually. Ito po ay entail na wala na tayong wide restrictions katulad ng mga MECQ at ECQ dati.
We will vigorously pursue the economy's full recovery to restore jobs and bring more people out of poverty. These policies will facilitate our shift to an endemic paradigm where we learn to live with the virus and promote the overall welfare of the people beyond COVID-19.
However, Wong says the Philippines still needs to vaccinate the unvaccinated, especially the vulnerable.
This herd immunity is not possible anymore because both Delta and Omicron are more transmissible than the original strain, and our vaccines are less than 100% effective.
So far, More than 58 million Filipinos are fully vaccinated. The government targets to inoculate 77 million by the first quarter of 2022.
You have to stop transmission to stop mutation.
But Wong notes that there is no certain way to know how long it will take until the COVID-19 pandemic is over. As the virus continues to evolve, health experts remain cautiously optimistic.
I still remain optimistic that this can be the year we can not only end the acute stage of the pandemic, but we also chart a path to stronger health security.